Hi, I'm Dr. Ed Kanzati. I'm a clinical director for General Dental and a practicing dentist in Vancouver, Washington. Oral health affects not just our teeth and appearance, but can have an impact on heart disease, diabetes, cancer, infectious disease, birth complications, and much more. At General Dental, we understand the impact oral health has on overall health, and we take a complete health dentistry approach to care. You'll understand why after viewing this segment on how oral health affects your overall health.
In American hospitals alone, the Centers for Disease Control estimates that hospital-acquired infections, an infection you didn't have when you came into the hospital but got while you were there, account for an estimated 1.7 million infections and 99,000 associated deaths each year. And for some of those who survive the infection, their lives are changed forever.
I'm an advocate for patient safety, and I have a passion about it. They call it obsession where I work, but it's just a passion because I love to protect my patients. That's what I do. One lady told me, I asked her if she had periodontal disease, and she said yes, she knew she had it, but that it was expensive to treat. She didn't have dental insurance, and she was having a total knee put in. So she had her total knee. She went home. A few months later, she got infected. They had to take her knee out, and then she had to live without a knee for a while. And then they put a new knee back in. It got infected. They took it out, and when I was her nurse, 2 years later, I was her nurse, they were amputating her leg. And she didn't know anything about periodontal disease, but she had an infection. And when she went into surgery, her husband told me that the cost of their medical bill for the past 2 years was $2 million.
They now tell us that half of America has a condition known as periodontal disease, which is more significant and more severe than gingivitis, which people get from time to time. But half of the people, what it says to me is half the people that now go into surgery have this condition. There are a couple of ways that this is a problem. In surgery, it's not that the bacteria from the patient's mouth is going to end up in, say, like a knee surgery. It's that the body can only fight infection on so many fronts. And it's like a war. It has a certain amount of resources it can allocate to that fight. And when you have an infection elsewhere in your body, it's allocated resources to that infection site. And then when you go in and do a surgery, you create another wound, and that wound demands that the body put attention to it too. So the reason you don't do surgeries on patients who have infections is because it diminishes their ability to recover from the surgery and increases the likelihood that any other bacteria could then take hold because there just aren't enough antibodies to fight that infection. From a financial point alone, if you look at the cost of a standard post-operative infection, it's between $15,000 and $30,000 per incident. And that's a cost that's generally borne by the hospital itself. But if you really want to know the truth about what we're being able to do, when you look at the long-term care industry, 90% of those patients have an oral infection. 90%. And when you think about that, and you realize these patients have a lot of other conditions. They have heart disease, they have diabetes, they have ulcers, they have pressure wounds. All of these are made bad or worse by this periodontal condition. The real good news is that there are easy, non-surgical ways of correcting the condition that you can get from your local dentist.
It's clear to see that the inflammatory burden caused by periodontal disease is a serious problem. But the mouth is also the home of many other preventable chronic diseases that plague our society, some of which goes untreated and undiagnosed for years.
Hi, this is Dr. Ed Kanzati again. I hope you learned something from this segment. It's clear that oral health has a direct impact on many health conditions. At General Dental, we have taken this message to heart and recognize the role that our dentists and hygienists play in helping our patients maximize their overall well-being. That's why we give our clinicians additional training in comprehensive exams designed to screen for signs of underlying health conditions, including oral cancer, heart disease, and diabetes. While this is not a replacement for a medical exam, the fact that we typically see patients more often than they see their physician puts us in a unique position to help identify potential early signs of underlying problems. We at Gentle Dental embrace the complete health dentistry approach to care and hope you do too. For more information on Gentle Dental, visit www.gentleone.com or call us at 855-GENTLE7. Thank you.